If we think about digital healthcare, we assume that everybody has universal access, but around 1.2 million people in the Greater Manchester area alone actually are not regular internet users. So if we're providing healthcare through the internet, how are we catering healthcare for those 1.2 million users? Most of my research focuses on issues around health equity, typically for socially excluded or marginalised individuals and communities who often have poorer health outcomes. They die earlier and spend longer periods of their lives living in poor health. It's really interesting when we think about the types of people that are socially excluded. It's actually a much bigger community than you think of. It can include issues such as age, gender, ethnicity, race, health status, poverty. When you're socially excluded, often it's really hard to access healthcare services. And if you can access them physically, there might be barriers around confidence or feeling that you're going to be judged that inhibit people feeling confident to be able to speak to practitioners that are there to support their health. We know that there's an increased focus on using digital technologies to promote health and to access healthcare, but that can be really challenging for those that perhaps don't have access to a computer or do have access to a computer but don't have the confidence or the ability to utilise that computer. So when you're designing any service, I think it's really fundamental that inclusivity drives the development of that service. And so by that I mean it's really important to engage the people with lived experience, the participants that you're trying to reach, to understand some of the challenges and barriers. It's also really important to work with the nurses and the other healthcare practitioners that are delivering those services. They often know some of those community groups, and I think actually by coming together with the three parties, you're really going to be designing a service that's much more effective and really easily accessed by everybody. I think we need to be really careful though that there is nothing more unequal than the equal treatment of unequal people. So it's not about giving the same to everybody, because if you give the same to everybody, you're going to perpetuate inequities. It is about a tailored approach that really enables us to think about what are the unique issues and barriers for that particular group and how can we address that by designing our services to be much more inclusive. It starts in Salford, a place where ideas are formed that shape the world.